it's still very common to have detention. It's still very common to have suspension. It's still very common to say, hey, go and sit in your room and come back when, whatever, as if that solves the issue. So why do we still have these practices? Why do we still, as parents even, insist on this behavioral approach?
Because we're not sure what else to do.
Hmm.
It's my best explanation.
Hmm.
I was reading an article in the Boston Globe this morning about an initiative to get rid of suspensions in kindergarten through third graders in the Boston public schools.
Hmm.
And the comments on this article were mind blowing. People were saying it's okay to suspend a kindergartner through third grade because of their behavior. And I'm thinking, um, if y'all think a suspension is going to fix anything, all you're really doing is kicking the can down the road because when the kid comes back, all of the expectations they were still having difficulty meeting are still there. So, what have we accomplished besides push the kid out at a very early age?
Mhm. And from your practice and from what you see going on overall, just in a bigger perspective, what this, practices leads to?
Well, when you suspend a kid, it's not just usually once.
Yeah.
It's usually many, many, many times over a period of many years. All right, so a few things are now happening. You are communicating to the kid that they belong out, not in. You are pushing them out of the very environment that is supposed to know how to help them.
Mhm.
You are not solving any of the problems that are causing the behaviors that are causing us to suspend them in the first place. So the pile of unsolved problems simply continues to grow. This
Mhm.
is the perfect recipe for causing a kid to become alienated, hopeless, disenfranchised, marginalized. We know the recipe. Why do we keep doing it? You asked that a few minutes ago. We're not exactly sure what else to do. Well, collaborative and practice solutions is an evidence-based model for what
Mhm.
else we should do. And of course, my passion is making sure that as many people as possible know about that model.
Mhm. Could you elaborate a little bit on the research and this scientific base of the model? So people.
Well, the hub of collaborative and practice solutions is the nonprofit that I founded, Lives in the Balance. And the web address is livesinthebalance.org. I'm sure you will make that available to people.
Mhm.
On the Lives in the Balance website, there is a research page that lists all of the studies that, in one way or another, contribute to the evidence base for this model. And people are going to see that there are a lot of studies contributing to the research base for this model that help us understand why this model is recognized as evidence based. It's evident. It works in schools. It works in families. It works in treatment facilities. It's worked wherever we've done it.
Mhm.
It's evidence based. That's the gold standard.
Mhm. Great. So let's move on. And okay, we have someone who is really curious and interested and want to try something different than what they already know. So, what would be the first steps for someone who would like to shift to this approach, being a parent? Like,
There is a guided tour on the Lives in the Balance website.
Mhm.
People go to Our Solution and then scroll down to either parents and families or schools and facilities.
Mhm.
They will find all kinds of streaming video explaining the model. It's all free, explaining the CPS model.
Mhm.
That's a very good place to start, and it doesn't cost a nickel.
Mhm.
They want to buy a book. If they're a parent, they could buy The Explosive Child. If they're an educator, they could buy Lost at School.
Mhm.
If they don't have a kid with concerning behavior, but just a kid who doesn't, they could buy the book Raising Human Beings.
Mhm.
Those are the books. Those are good places to start. But of course, starting is not the same thing as doing. So we want people taking in these resources with the expectation that they will actually start to do something differently.
Yeah.
And in all of those resources, there are lots of examples and step by step for what they should do next.
Mhm.
Um, What they should do next is start identifying for their own kid or the kid they're working with the skills that are making it difficult for a kid to respond adaptively to problems and frustrations, and all of the expectations this kid is having difficulty reliably meeting. And they can do that using an instrument that we call the Assessment of Skills and Unsolved Problems, also free, also available on the Lives in the Balance website. Once they identify those unsolved problems, they need to pick a few and start solving problems. And they got to know they're probably not going to be good at it in the beginning. This is an acquired art. Even people who work with kids a lot have a little difficulty shifting from simply knowing what's getting in the kid's way and knowing what the solution is to figuring out what's getting in the kid's way with the help of the kid and figuring out what the solution is, once again, with the help of the kid. That takes a little change. That's not most caregivers' muscle memory. That's not what we are accustomed to doing. So people got to give themselves a little grace and give them time to get good at this.
And you already mentioned about the tool that people could use to assess the situation, so they're better equipped, let's say, with what's going on and understand what could be the first steps. But I was thinking that there are like different kind of skills probably that the child could lack, maybe some cognitive, some emotional skills. Could you explain a little bit more to the audience, like what are the skills we're talking about, and maybe depending on the age, because I would assume the, let's say, newborn is very different probably from the 5 years old child.
You know, you'd be surprised. It's not that different.
Okay.
But the skills we tend to talk about, the global skills, are flexibility, adaptability, frustration tolerance, problem solving, and emotion regulation. These are the skills the research tells us are frequently, that kids with concerning behaviors are frequently struggling with. It's good for caregivers to have those lenses on, because if they don't know that concerning behavior is about skills, then they might think that the kid is doing it on purpose, either for attention or to manipulate them or to coerce them into capitulating to their wishes. We could take the wrong turn here as it relates to why is this kid really exhibiting these concerning behaviors. The best way to think about those concerning behaviors, once again, is that they are the way the kid is communicating to us that they are frustrated. And kids who have very big behaviors have very big frustration responses. And those frustration responses are often making it difficult for them to think when they need to be thinking the most, which is when they're frustrated, right? So this is a learning disability, no different than any other learning disability. That's how we think of it. This is about skills, just like every other learning disability. And those are very important lenses for caregivers to have on. I frequently tell caregivers, your kid, he's getting upset about the same stuff that most kids struggle with. So your kid is not unusual in terms of what they're getting upset about. How upset they're getting is what's making your kid unusual. That's about skills, right? Very important for caregivers to know that this is about skills, not motivation. If they think it's about motivation, they're going to get started with the rewards and punishments, motivational strategies, but rewards and punishments don't solve any of the problems that are causing a kid to exhibit those frustration responses in the first place. But we have wasted, and us caregivers have wasted an enormous amount of time rewarding and punishing kids for problems we could have been busy solving all along.